That's the pec major. What's this one right here? What's this one? What's that? No, that's your platysma. That's the platysma muscle. It covers it, right? Very thin muscle. You can do that with your neck. Something SpongeBob would do, right? He had one. Right? And then you come around here, and you see your SCM. What's the SCM? Sternocleidomastoid. Right? And this is your trapezius muscle coming down. Right? There's your deltoid. Okay. Then there are some muscles that are very important in here I want to go over before we do the facial expression. This is a muscle that moves the neck. It also is associated with forced inspiration. They're called the scalenes. S-C-A-L-E-N-E-S. Scalenes. And the scalenes, you know what's great? Your exam is not next week. It's the week after.
That's right.
We have a whole nother week. I'm thinking the exam was next week. I was planning. So we took the SCM off, right? And what you see here, deep, if you could see this and bring the cameras close, 26, 25, and 24. See those three muscles? These are called the scalenus anticus, or the anterior scalene. Scalenus in Latin, anticus. Scalenus medius, and scalenus posticus, posterior, right? So the anterior scalene, the middle scalene, and the posterior scalene. Okay, those muscles are clinically significant in sinus problems and drainage problems and neck problems and forced inspiration and sneezing problems. You know, they get very tight and spasmodic. What you see here, this is your temporalis muscle. Let's turn it this way. We're going to talk about the muscles of the TMJ, the muscles of the jaw. So you don't see the temporalis superficially. It's actually underneath. This is the temporal auricularis. Underneath the auricularis is the temporalis. That's your temporalis. It goes under and into the mandible. It inserts into the mandible over here. Notice the mandible is cut here because it's showing you the deep muscles of the TMJ. Let's turn it this way. Here, the mandible's not cut, and we have some muscles superficially we need to look at before we look at the muscles of the TMJ. And you can see this is your parotid gland. Did you ever chew a piece of gum and something squirts out? You ever had that? It's like, what the heck was that? You know, when you chew something, you went to take a bite of something, squirts right out of your mouth. That's the parotid gland squirting its saliva through a duct. There's a duct that goes inside the mouth and squirts the saliva in from the parotid gland. So the parotid gland is actually superficial, and its duct makes its way in. And then this is your this muscle right here underneath the parotid. It's called the masseter. The masseter. That is a muscle of the TMJ. The masseter is a muscle of the TMJ. And you can see it when someone clenches their teeth and chews. Sticks out, so does the temporalis sometimes, right? So they do stick out sometimes. So that's your masseter. And then there's some other muscles of facial expression we'll come to, but let's look at all the muscles of the TMJ first. So masseter is one. Temporalis is another. And then there's two muscles deep, and there's a lot of controversy whether there's two or three of them, but they're called the pterygoid muscles, P-T-E-R-Y, like the pterygoid process of the sphenoid bone. Remember that? The pterygoid muscles, there's an anterior and or a medial and a posterior or a medial. Just name them as pterygoid. This one and this one. That's your pterygoid muscle right there.
So that's beneath the...
beneath the mandible. Yeah, beneath the mandible, under the bone. You can't get at it this way. The only way to get at that muscle, if you want to treat it without surgery, is with a glove inside the mouth. And I've done it many times and helped a lot of people with serious sinus pain and drainage. It's amazing. I had one patient, she had severe headaches so bad she was vomiting. She came in, she couldn't even move. I did that work, and she called me back at the end of the day. I adjusted her neck too, and she said, it is completely gone. The pain that I had. I could not sleep all night. It's completely gone. It's like a miracle. She's never had that relief in all the years. So that muscle is very significant clinically, but it's deep inside. And you can get spasms of that muscle when the jaw is out of alignment. Jaw goes out of alignment very easily. Just think about it. First of all, the way you sleep, number one. But your teeth, when you close your mouth, your teeth have to sit on top of each other equally, right? And if the one tooth is higher than another, it makes it tilt. And it causes the muscle tone to change, kind of like you have a short leg, right? And until you correct the bite, it's never going to be corrected. So the dentist has to grind the teeth, and you've had that done. Whenever they do dental work, they have you bite down, they look at that piece of paper.
You get a mouth guard.
Yeah, they're looking to see the height of the bone, and then they shave it down a little bit so it's equal. Because if he left you unequal, it would cause TMJ problems. Right? Okay. Very easy. You get that corrected. You get your masticatory glide. This is called mastication. Chewing is called mastication. These muscles of the TMJ are also known as the muscles of
Mastication.
mastication. That's right. And when you have a masticatory glide, the masticatory glide is when you close your mouth gently, you can slide it side to side without getting hung up and stuck. If you can't close your mouth gently and slide your mouth side to side equally without it getting stuck, you're going to have problems with your TMJ if you don't have it already. So that has to be corrected so you can have a normal masticatory glide. That means with the teeth closed. Not tight, just touching each other, right? That's important. Very simple. That's probably one of the best advice I can give anybody, because you can go, I got a call today from a TMJ patient who goes to a neuromuscular dentist. A neuromuscular dentist is one of the specialties that treats TMJ, and you're going to drop 30 grand if you go to him. There's no doubt about it. If you're going to try and get the treatment, it's 30 grand minimum. But what he does is miraculous as far as your face. You can have TMJ problems for years, and it alters your face. And what he does, he takes photographs, he completely corrects your bite, completely corrects your teeth, perfect, with beautiful teeth, all in one shot, and now you have a beautiful smile and a beautiful face, and your pain should go away. He sends patients to me to get their atlas adjusted, so that when he finds the neutral, that they have a neutral, normal neutral, there's no muscle spasms. Because when your atlas is out of alignment, it affects the muscle tone all over the place. So it's nice to at least get your bite checked first before you go see someone like that. You know, because you can save a lot of money. There's a lot of headaches. You know, those appliances you wear an appliance at night, and he comes back and fits it. And his evaluation for the jaw, without x-rays, he has x-rays too, just this elaborate EMG, watching the muscles move and open and close your jaw. I saw the bill is $5,800 for like an hour evaluation of the jaw. Not even an hour. Wow. But you know, when you walk in his office, you're paying money, because he's got like high ceilings with a fireplace and a leather couch in the waiting room. So you know, right away you know the 10-foot doors, the solid oak 10-foot doors. As soon as you walk through the 10-foot door, you're going to pull out the credit card and ka-ching, that's right, ka-ching. But he's a good guy. He's very intense. He just likes, you know, he gets paid. He's in West Hampton Beach.
Oh.
Is that part of dentistry, or is that like...
He's a dentist. He's a dentist, and he went for special training to be a neuromuscular dentist. It's postgraduate stuff. There's two fields in TMJ treatment. One are the ortho approach, and one is the neuromuscular approach. Ortho approach says, you know what? The bone is out of place. We need to get it right into position. And even if there's bone spurs, they push it right into that spot, and it causes problems. Neuromuscular dentist finds your neurological neutral. Because you have bone spurs, where is your jaw moving without pain? Then he tries to balance it, and then he builds the teeth to the jaw. You follow? And so he corrects the whole facial expressions, because if you're tilted on one side, you have drooping on one side and tightness on the other. Because
So not muscles, or not bones? Like if your jaw locks.
muscles
Like
doing
when
it.
you
The muscles
shake
doing it,
your-
yeah.
And like that click.
That's it. Now, the lock, the click doesn't mean it's locked. Lock means you can't move it, right?
Yeah, but like when you
stuck.
Like
It gets stuck.
Yeah, and it doesn't close.
You know, you have to evacuate. Yeah, it
So
could
not
be.
that
Could be a combination of muscle and the joint is now destructed over time because the muscle's been pulling so much. That's what happens when, look, if your car is out of alignment and you drove your car, what would happen to all the parts of the front end? Your front end alignment's off and you drove it for 10 years, what would happen to it? It would wear out. You get problems, right? And machines wear out, but human beings build around it. So you get spurs and arthritic spurs and all kinds of stuff going on there. So if it's out of alignment, it's going to trigger the changes in the bone over time. So that's why the neuromuscular dentists I think, are a better choice than the orthos because they believe that you have to look at this person. Where are they now? Instead of doing surgery, let's try and do a way of building around it to find a neutral thing. Anyhow, okay, so let's facial expression. You have the frontalis or epicranius, and the gala aponeurotic was the aponeurosis for that. And in the back, you have the occipitalis, connected to the same aponeurosis. Then around the eyes, you have the orbicularis oculi, helps to close the eyes. And around the mouth, the orbicularis oris. So that's your kissing, that's your closing your eyes or squinting your eyes. Then you have your corrugator supercilii, which is the one that gives you the scowl, like it brings your eyebrows together like this. Corrugator supercilii, right? Frontalis, corrugator supercilii, orbicularis oris. And I'm not going to ask you the one that elevates the eyelid, but there's one called the levata palpebrae superioris. But I won't ask that on the test. That one just specifically elevates the eyelid, right? And then you have your zygomaticus. Now they have zygomaticus major and minor. You can't tell on the model. So just name it as zygomaticus. That's a smile muscle, like the Joker smile, real sinister smile, right? The two corners come up. And then you have your depressor anguli oris. There's your frown muscle. Depressor anguli oris. And then you have your depressor labii inferioris. That's your pouty one, the boo-boo lip. You know. Sorry. Sorry about that. Okay, so that's enough for the facial muscles. We did the TMJ, temporalis, masseter, pterygoids, all TMJ muscles. Muscles that close or muscles of mastication, same thing. We did our platysma, your SCM, and then we did our scalene anticus, medius, and posticus. On the back, here's your trapezius muscle, and then this is your splenius capitis, right underneath. Splenius capitis. Okay? Mm-hmm. And you can even see on this model, look, I could test you here. I could put this like this, take this out. I could put a sticker here and put a sticker there. What's that? What if I put a sticker there? What is it? Supraspinatus. So put a sticker here.
And first spinatus.
Right. So this is splenius capitis. This is splenius cervicus.
Can you spell it? Because that's not in the book.
It is in the book.
Oh, it is?
Yeah, splenius is S-P-L-E-N-I-U-S, and cervicus, C-E-R-V-I-C-I-S, cervicus. So that's going to the cervical spine, see? And capitis goes to the cap.
And that's what
Yeah, splenius capitis, splenius cervicus, splenius posticus, medius anticus. Before you're done, you're going to be a bunch of Roman soldiers, right? All righty. So that's that.